no rash you can see, no obvious bite. But the itching just won't stop. You scratch, then scratch again. Daytime is uncomfortable. Nighttime is worse. And slowly, that itch begins to take over your thoughts. If this feels familiar, you're not alone. Today we're going to talk about generalized itching, what doctors call generalized pruritus, and more importantly, why it happens, even when your skin looks completely normal. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes and hormone specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, don't forget to subscribe to this channel for more simple, science-based, doctor-reviewed health videos that help you understand your body better every day. Now, let's slow this down and make it simple. When doctors say generalized itching, we don't always mean itching literally everywhere. We mean itching that affects more than one body area, not just one small spot. And when someone comes in with this complaint, the very first question we ask ourselves is the problem in the skin itself? Or is the skin reacting to something happening inside the body? Let's start with the most common reason of all: dry skin. Yes, something that simple. As we age, our skin naturally loses moisture. Frequent hot showers, harsh soaps, dry winter air, or constant indoor heating can strip the skin of its natural oils. The result is tight, flaky skin that sends constant itch signals to the brain. In fact, for most people with widespread itching, dry skin is the answer, even if it doesn't look dramatic. Now, sometimes the skin is visibly inflamed. There are long-term conditions where the immune system makes the skin overly sensitive. These often start early in life, run in families, and flare up during stress or weather changes. There are also reactions caused by direct contact with something, a soap, detergent, metal, fragrance, or fabric, where the skin becomes irritated or allergic simply because it touched the wrong thing. Some people have thick, scaly patches on their skin that itch badly at night. Others develop raised, red, itchy welts that come and go suddenly. These welts are often called hives, and while many people think they're always allergies, the truth is, they can happen for many different immune reasons. Now let's talk about something doctors always watch for carefully: scabies. This is caused by tiny mites that burrow just under the skin. You can't see them, but you can feel them. The itching is intense, often worse at night, and it spreads easily in crowded places: group housing, care facilities, shelters, dormitories. Scabies isn't dangerous, but it is contagious, which is why recognizing it early matters so much. Other infections can also cause itching. Some fungi live on dead skin cells and thrive in warm, moist areas of the body. Others get spread through repeated insect bites, like bedbugs, leading to widespread itching without an obvious rash at first. Now we move to the second big category: itching caused by internal medical conditions. This is where itching becomes an important warning sign. One of the most common causes seen in hospitals is kidney failure. When the kidneys aren't working well, waste products build up in the blood. These substances irritate nerve endings in the skin, causing relentless itching, even without a rash. Many people on dialysis experience this at some point. Another major cause is blocked bile flow from the liver. When bile can't flow properly, bile salts build up in the bloodstream and trigger intense itching. Sometimes this itching appears before any yellowing of the eyes or skin. Certain autoimmune liver conditions, medication reactions, and even pregnancy-related liver changes can cause this type of itching. Then there are certain blood and immune cancers where itching may be an early sign, sometimes appearing months or even years before diagnosis. Unexplained itching with weight loss, night sweats, fever, or swollen lymph nodes should always be taken seriously. There is also a rare blood condition where itching happens after contact with water. No soap, no heat. Just water touching the skin triggers it. Autoimmune diseases that affect the skin and connective tissue can cause itching as well. Hormone disorders involving the thyroid may sometimes contribute, and chronic viral infections, including HIV, are known to be associated with generalized itching. Finally, there is the other category. Some medications, especially pain medications like opioids, are very common triggers. This is not an allergy. It's a direct effect on itch pathways in the brain. There is also itching linked to mental health conditions. This diagnosis must be made carefully because chronic itching itself can cause anxiety and depression. Doctors must be sure which came first. And sometimes, despite thorough testing, no clear cause is found. When itching lasts more than 6 weeks with no identifiable reason, it's called chronic itching of unknown origin. So how do doctors figure this out? First, we listen. How long has the itching been there? Is it constant or does it come and go? Does water trigger it? Is it everywhere or certain areas? Are there other symptoms? Yellowing of eyes, weight loss, fatigue, swelling? Then we examine the skin carefully. We also check lymph nodes and sometimes the thyroid. If the skin exam gives us the answer, no tests are needed. But if the cause isn't obvious, basic blood tests help us look at blood counts, kidney function, liver function, thyroid levels, and infections. A chest X-ray may be done to look for hidden lymph node swelling. Now let's bring this all together. Most generalized itching is caused by simple, dry skin. But scabies must always be considered because it spreads easily. Kidney disease, liver disease, certain cancers, HIV, and medication side effects are important causes doctors never want to miss. And if itching doesn't improve with basic treatment, or the skin looks normal, further evaluation is essential. If you're dealing with chronic itching, know this: your body is trying to tell a story. And that story deserves to be listened to. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, medicine specialist, diabetes and hormone specialist. Information collected from Mayo Clinic, Cleveland Clinic, and NHS UK. If you found this video helpful, please subscribe and share it, because awareness is the first step to healing.